Just to jump to the Yelp topic, and it's a little relevant for once you're on Google Maps also, because people can leave Google reviews. Because of HIPAA, if you receive a bad review through Google reviews or through Yelp, it sometimes puts you in an awkward situation on how to respond to that review, because you can't really write back and say, this person refused to pay me and got angry when I asked for payment and then said I was a terrible provider. It's a complete lie. Like, you can't disclose.
Right.
They can write whatever they want about you, but the normal response to the different platforms when you have a unpopular review is, sorry you had a bad experience, and can't disclose anything due to confidentiality reasons. We all know that people are more likely to leave a negative review unprompted versus a random positive review. So, what are the ethics around, if you've been working with a patient or family and done very well, and I'm not saying I know the answer to this question, but, can you ask your patients to leave a nice review for you? I think it's very clean for, like, my dental provider. They're always saying, we love reviews. Please review us. Get a $10 off coupon if you do a review. They're also bound by HIPAA and confidentiality laws, but, it feels like there's something different between a dental practice and a mental health practice.
There's such a stigma, I guess, around mental health. It's hard to feel willing to put yourself out there and say, hey, I want to say my therapist is great and admit to the whole world that I go to therapy. And, there's, for some people, that may not be a problem. For other people, that might be, of concern because of the stigma that still exists. So
yeah, and we're doing better on the stigma, thanks a lot to teenagers and younger generations. But as you said, it's still something that's not totally comfortable for everyone. Maybe we'll get there someday. Is it okay to ask a satisfied patient to leave a positive review for you on Yelp or Google reviews? And I definitely think in certain circumstances that is okay. I think it's especially clean if someone is better and kind of graduating and has had a good experience with your treatment, to say, hey, you're under no obligation, but we're finishing our time together. And yeah, if you'd like to put a review up on Yelp or Google reviews, that would be awesome. It's very tricky to ask a current patient to do that, because they're going to think, oh, what if I don't leave a great review? Is my provider going to play mind games with me, or, not be as happy to see me? And
I mean, that actually makes a lot of sense, because when you think about a service that somebody is providing you, and that's what these reviews are for. It's the whole experience of what it was like to be a consumer of whatever this thing was. And I guess when you operationalize, like, what are you getting from a therapist when you are graduating from therapy, that is kind of like a way of saying you've gone through, like, the whole course of what this person had to offer you. And that's, rather than being like, if I reviewed a movie halfway through the movie, that wouldn't be, indicative of what the full experience of that movie was. So that's just the thought that popped into my head when you brought that up. That is kind of an ideal user group to be leaving you a review, as somebody who is, graduated, as you put it.
Yeah, I would say that there are some cleaner feedback methods. And for example, you can give a kind of a customer satisfaction survey with, like, your intake process. How did that go? Right. And you can kind of put that on your own website. Like, here's some things my clients say about me. You can ask people, if you've got a large enough group, you can easily set up leave an anonymous review on your website, where you could ask people to leave anonymous reviews. And if and you could take those and put them on your website as well. So there are some ways to get anonymous information about how you're doing as a provider and get that information out there. And certainly, you know, if you are working hard for your patients and doing a good job, we are in this culture where reviews are more common. So lots of times you would just be pleasantly surprised that you'll see a patient will put a good review up there and maybe use their initials or a pseudonym or just put their full name out there. And that's always a nice feeling.